Okay, so today I am going to tell you about the pericardial effusion, and from where I am reading, I am going to provide you the link in the description below. And always make a habit to read it from the authentic sources. So, this is from the very much authentic source. It is NCBI article, and pericardial effusion. If you see that, what actually the pericardial effusion is. So, pericardial effusion is the accumulation of fluid in pericardial sac. Okay, and what the normal fluid accumulation is? Normal fluid accumulation is between 15 to 50 ml. Okay, if it exceeds greater than 50, you will see the effusion symptoms. Okay, so here you can read out that what actually the pericardial effusion is. It refers to the accumulation of excess fluid in the pericardial sac that surrounds the heart, and the normal fluid that contains is 15 to 50 ml of serous fluid. Okay, and what are the causes of this effusion? It's simply because of the infectious cause. Here you can read out it's due to the infection. Pericardial effusion may be due to the infection with the bacteria, viral, fungi, or even parasitic pathogens. Okay, it is inflammatory. Inflammatory means if you are having any of the autoimmune diseases, including SLE, RA, Sjogren syndrome, okay, then you are going to have the fusion. Next is neoplastic. Both metastatic disease and primary cardiac tumors can result into the pericardial effusion. Okay, if you are having any injury, trauma, that is blunt trauma, or so the blunt trauma, it causes the accumulation of blood within the pericardial sac, and if the blood is accumulating, it is called the hemopericardium. Okay, next is if you are having any of the post myocardial infarction. Okay, then it is going to result into the pericardial effusion. These are some major causes, and if moving on to the clinical features, so if summarizing it, what actually the pericardial effusion is, I have stated. What are the causes? If I summarize the causes, first cause is simple, that you have any infection by the bacteria, fungi, virus, or any other, any inflammatory conditions that is happening in the body. Okay, next is you are having any post mi, that is referred to as Dressler's syndrome, and any of the trauma to the chest wall, and any neoplastic conditions. These results into the pericardial effusion. Now, if I discuss with you the clinical feature, सिंपल सोच के देखो कि अगर किसी को पेरिकार्डियल एफ्यूजन हो रखा है तो क्या होने वाला है. एफ्यूजन फ्लूइड एक्यूमुलेट हो रहा है, ठीक है, तो क्या होगा कि जो आपको हार्ट साउंड सुनाई देगी, वो थोड़ी हार्ट साउंड जो होंगी वो आपको कम सुनाई देगी, उनकी जो इंटेंसिटी है वो डिमिनिश हो जाएगी. ओके, सो व्हाट इज़ द फर्स्ट क्लिनिकल फीचर, कि जो हार्ट साउंड्स हैं वो आपको थोड़ी क्वाइटर सुनाई देगी, ठीक है, उनकी जो इंटेंसिटी है वो डिमिनिश हो जाएगी. ओके, नेक्स्ट आप देखो कि फिर क्या होगा कि आपके जो स्टर्नम है उसका ऑपरेशन होने लग जाएगा. ओके, and what is the next clinical feature, you can see it here, that there will be the precordial pain. Okay, and precordial pain is typically precordial pain which is stabbing increase on inspiration, coughing and body movements, and radiating to neck, arm and back. Precordial pain होगा that radiates to the neck, arm and back. डल एकिंग पेन होगा, ये पेन होगा राइट लोअर चेस्ट में, बिकॉज ऑफ हेपेटिक डिस्टेंशन। ओके, और आप देखोगे यहाँ पे आपको पल्स कैसी मिल रही है, पल्सस पैराडॉक्सस। ओके, एंड JVP you are finding markedly elevated and increases on inspiration. Apex beat is not felt or very feeble felt. Increase cardiac dullness. Upper border in the second space, right border parasternal and left border outside the apex. Okay. नेक्स्ट, हार्ट साउंड आपको मफल्ड मिलेगी, थोड़ी क्वाइटर मिलेगी, पेरिकार्डियल फ्रिक्शन रब मिलेगा आपको देखने को। और यहाँ पे एक इम्पॉर्टेंट सिम्टम ये है कि ECG में जो QRS कॉम्प्लेक्स है, ये जब आप इन्वेस्टिगेशन कराओगे तो ECG में आपको जो QRS कॉम्प्लेक्स है वो भी थोड़ा, उसका जो वोल्टेज है वो कम मिलेगा। ओके, एंड एक्सरे इज शोइंग water bottle sign, water bottle configuration in upright position. Okay, so this is the important part of the pericardial effusion. Okay, so first is heart sound is quieter, diminish in intensity. Next, what I have told you, that pericardial pain, okay, एंड JVP इंक्रीज्ड मिलेगी। ठीक है, उसके बाद आप देखोगे और क्या सिम्टम्स हैं, तो आप देखोगे साथ में आपको, अगर आप इन्वेस्टिगेशन पोर्शन पे जाओ, सो इन्वेस्टिगेशन में जो आपके ECG है उसमें आपको क्या मिलेगा, लो वोल्टेज QRS। ओके, एंड जो एक्सरे है उसमें मिलेगा वाटर बॉटल साइन। ओके, तो ये इम्पॉर्टेंट बातें हैं जो आपको समझनी है रिगार्डिंग द पेरिकार्डियल एफ्यूजन। ओके, so that's all the important part I have discussed with you about the pericardial effusion in this video, and whatever sources I have used to describe you, I will provide the information about them in the description below. You can check out these information what I am providing. This is a book from where I told you about the pericardial effusion by PJ Mehta, and next source which I used is the NCBI article. That's very authentic source. Okay, so both the information I will provide you in the description also. Okay, so that's all for the today's video. I hope this video is going to be useful and helpful to you. If you find out this video useful, share out with your friends and colleagues. Thanks for watching. Homeopathy.